Medical imaging refers to the techniques and the processes used to create images of various parts of the human being for diagnostic purposes and treatment. So electromagnetic wave is the main function and component in this industry. And the most common, as we know, are X-ray, CT scan, MRI, or ultrasound, and or even PET scan. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhsin, and today we'll be talking about a forum titled "The Good and the Bad Part of the Medical Imaging." So joining me will be three amazing panelists. The first one coming from a radiologist coming from University of California, Professor Dr. Amir Aziz.
Thank you for having me.
Welcome, Doctor. The second panel will be an oncologist and a radiotherapy expert, Dr. Azizul Hakim. Welcome, Doctor.
Yeah. Thank you, Mr. Muhsin, for this opportunity.
And our third panel is a medical imaging technologist, Dr. Muhammad Afiq. Welcome, Doctor.
Thank you, Doctor.
So let's just dive right into it. So my first question goes to Dr. Amir Aziz.
Yeah.
Being in this industry, how does the industry has changed over the years? Like, what is the history or the evolution of this medical imaging?
Okay, the evolution of this medical imaging, a lot has happened in the medical imaging during the past 50 years, and many people play a leading role in the imaging industry today. Report by Sir Diego Oligo, the Chief Technology Officer in Department of Information Engineering, says that he mentioned we have seen the clinical practice revolutionized through the advent of modalities like magnetic resonance, MR, compute tomography, CT, ultrasound, and tailored hybrid imaging system, such as positron emission tomography (PET).
So what you're saying is there are a lot of ways the wave spectrum has been used in the past years.
Yes.
So I mean, you know how the evolution are. So can you tell me like what are the advantages of this application in this medical imaging?
Okay, the advantages of this medical imaging is, as we know nowadays, electromagnetic radiation is widely used in studies like radiology, angiography, and computer tomography scanning. Studies from University of North Carolina at Charlotte say that X-ray has wavelength ranging from 0.01 to 10 nanometers. Thus, they are found to reside between ultraviolet radiation and gamma rays on the electromagnetic wave spectrum. Next, X-ray compute tomography, or known as CT scan, was the first modern imaging technology. A laboratory report from Medical Imaging Laboratory based in the University of Rhode, CT scan can be used for imaging the whole body in 5 to 20 minutes. The advantages of this X-ray imaging is it is a remarkable technique for analyzing deep structure inside human tissue. It is also used for observing the three-dimensional structure of infected tissue known as cancer.
So I mean, learning that it seems like the electromagnetic wave application is main key for the medical and health industry.
Yes, doctor.
Okay, so thank you, Doctor. So I want to go to my second panel, Dr. Azizul Hakim. I want to ask you, like, we have seen the advantages. Can you tell me, like, what is the effect on the human being body? Because I've seen, like, I mean, being an oncologist yourself, I'm sure you have a lot of cancer patients. I've seen, like, the tests they have gone through. It's really an eye opener. So can you like explain what is the effect on the human body and the surrounding?
Okay, thank you, Mr. Muhsin. Now, I will explain the effect of uh, MRI. That's some technique that used in medical image processing. Okay, based on article by Chen of D, MRI stands for magnetic resonance imaging. This MRI use radio wave technique to scan our body, to scan our cell body, our structure of our brain and our soft tissue. Ah, by doing this MRI, we can know some unusual macam tumor, like a tumor in our body. For this imaging to be successful, we should inject some isotope, some radioactive chemical into our body that call gadolinium medium contrast. Based on article by Inside Radiology, this chemical will make some irritation to patient. Some people might have allergic to this radioisotope chemical.
So you were explaining about the side effects, and also can you like tell me, is there a limitation in this industry? Like you were focusing on the allergies of, towards the isotopes also. Can you explain the limitation in this industry?
Okay, okay. For the limitation, based on the article, Medical Virtual Center, the we the purpose of the isotope is to make our body image clear, more clarity. Therefore, because of this allergic, we just have to put a bit like a milliliter of this isotope into our body. So, we could not get the more clear image of our body. So that was the limitation. Okay.
So thank you, Doctor, for the brief, very compact explanation. So I want to go to our final panelist, Dr. Afiq Along. So Doctor, can you like, I mean, we learned about the advantages, we learned about the limitations. So can you like explain what are the solutions that need to be proposed to avoid like the side effects given by Dr. Hakim?
Yes, alright. We can see that the X-ray CT scan can alter out DNA properties that lead to cancer. After I do some researches related to this X-ray CT scan, according Michigan Medicine from University of Michigan, they have pursued several important measures to minimize radiation exposure without sacrificing the image quality. First, the uses of the new technologies in order to reduce radiation, that's in radiography, mammography, and fluoroscopy. Next is to limit the region of the body that being scanned to the smallest possible area. Beside of that, all the equipment and the system must be tested frequently to ensure they are performing correctly and efficiently. Last but not least, with the all modern technology we have, all the engineering department have to focus on ways to further reduce radiation exposure through ongoing research. Furthermore, I would like to mention about gadolinium contrast medium injection, where a small amount minority of patients may experience side effects such as headache, nausea, and dizziness. If you have allergic reaction to a gadolinium contrast injection, please refer to doctor or the radiology facility where you're having the MRI. They also will consider whether you might need some preventive medication before any further gadolinium injection. There is no way to predict or prevent patients experience allergic reaction or side effect. If you have a history of severe allergic reaction, some people believe that taking some preventive medication in the hours the scan before the scan can reduce the risk of another reaction. If a gadolinium injection is thought essential to the diagnosis, the evidence that this pre-medication actually reduces the risk is not clear out.
Okay, Doctor. So, I mean, there were a lot of solutions and precautions taken to avoid side effects. So, can you like explain what is the future? Like briefly, can you just explain what are the future?
In looking forward to the future of CT scan MRI, radiologists should expect to see faster, more automated, and easier to use scanners. Electromagnetic spectrum method is absolutely useful for scanners when tracking the progress of an ongoing illness. MRIs and CT scans allow the physician to monitor the effectiveness of treatment and adjust protocol as necessary. The detailed information generated by medical imaging provides patients with better and more comprehensive area. Comprehensive care. I hope with future technology, those engineering will discover a new way method with least side effect to human. That's all
Thank you,
from me.
Doctor. Thank you, Doctor, for a very informative point about what the solution and the future of this industry. So, by from all of our panelists, I think we have learned that the industry have a lot of uses of the application of electromagnetic wave, and it has come a long way to make it very useful for our human being. So before I finish this forum, I just want to thank all the panelists for giving their time for such a very informative forum. And with that, that is all from us. We hope you enjoy. Thank you very much.
Thank you, everyone.